positivo.
Sí, positivo.
Another resident in Paterson, New Jersey, receiving some bad news, a positive test result for COVID-19.
Oh my God, no me diga eso.
Oh my God, don't tell me that, the woman exclaims during a call with members of the city's COVID contact tracing team, otherwise known as the Paterson Health Department, BC, before Corona.
We have to go in and see how many people in the family.
Joya Jenkins, lead investigator on the left, along with her fellow investigator, Alicia Espinal Mesa, now spend their days and nights reviewing incoming COVID-19 test results and mapping out who else that person could have exposed.
You're building a web.
Yes.
How large have you seen that web get in the most extreme cases?
We've had a house where it's maybe 8 people.
Patient 0 exposes 8 other people in that household. Each of those 8 people exposes 2 or 3 more. You get the idea. Tracking down everyone and letting them know they need to self-quarantine is time-consuming. But it's working. Paterson saw a high of 262 COVID-19 cases on April 16th. Just more than a month later, as of last weekend, that number was down to 6 known cases.
The effectiveness of Paterson's contact tracing team does not exist in a vacuum. In fact, the members' effectiveness really depends on the honesty they are getting from the people answering the phone. And there's one other cause for concern. Looking forward to the fall, all of this detective work could be compromised if surrounding towns do not pick up where Paterson leaves off.
On a pleasant spring morning, Dr. Paul Prasad delivers his weekly progress report to most of the 50-plus member contact tracing team outside the city's health department.
I know most of you, if not all of you, did additional training over the weekend through Johns Hopkins University.
His focus now, getting the rest of our region on the same page.
Now, I'm concerned that other towns may not have this in place, and in the event of a second wave, time will tell how that plays out, but we're ready.
Dr. Prasad actually convinced Paterson Mayor Andre Saya of the need for a contact tracing team last year in the event of an outbreak of disease or a possible foodborne illness.
Now it's an indispensable tool in our fight against COVID-19.
That proactive approach left Paterson, where a full quarter of the population lives at or below the poverty line, in arguably better corona fighting shape than some of its larger, more well-funded counterparts.
We have to make sure we have well-trained contact tracers,
including New York City, which is still gearing up its own contact tracing program. Back in Paterson,
we're gonna look up her contacts.
Putting the work in now could be the down payment this challenged city needs to survive a potentially devastating second wave of coronavirus. In Paterson, New Jersey, Jay Dow, Pix 11 News.